HLA Crossmatching B-cell crossmatch test, written in a comprehensive medical academic style covering all 15 sections in depth. HLA Crossmatching B-cell crossmatch test. Introduction. Human leukocyte antigen, HLA, crossmatching is a fundamental immunological test performed prior to organ or tissue transplantation. Its primary objective is to detect the presence of antibodies in the recipient's serum that could react with donor HLA molecules. These antibodies, if present, may trigger an immune response leading to graft rejection. There are two types of HLA crossmatches based on the lymphocyte type used. T-cell crossmatch detects antibodies against HLA Class I antigens. B-cell crossmatch detects antibodies against HLA Class II antigens. The B-cell crossmatch is especially important because Class II antigens play a significant role in chronic and antibody-mediated rejection, AMR. This test is a cornerstone in the compatibility assessment between donor and recipient and helps ensure the longevity of the transplanted organ. Definition: a B-cell crossmatch is an immunological laboratory procedure that determines whether a recipient has circulating antibodies that bind specifically to HLA Class II antigens on donor B lymphocytes. A negative result means no such antibodies are present, suggesting immunologic compatibility. A positive result indicates that the recipient has antibodies directed against the donor's HLA molecules, posing a significant risk of graft rejection. Number 3. Indications: B-cell cross-matching is indicated in several clinical contexts, primarily related to organ transplantation. Common indications include 1. Pre-transplant evaluation, mandatory before renal, cardiac, or liver transplantation. 2. Retransplant candidates, individuals who have undergone a previous transplant and may have developed anti-HLA antibodies. 3. Highly sensitized patients, those with high panel reactive antibody PRA levels, indicating broad sensitization to HLA antigens. 4. History of sensitization events, multiple blood transfusions, pregnancies, exposure to paternal HLA antigens, prior organ transplantation. 5. Living donor transplant assessment to ensure donor-recipient compatibility prior to surgery. 6. Bone marrow transplantation for evaluation of potential graft versus host disease, GVHD risk. 4. Used for the B-cell crossmatch test is used for detection of donor-specific antibodies, DSA, against HLA Class II antigens, assessing compatibility between donor and recipient before transplantation, preventing hyperacute or acute antibody-mediated rejection, guiding immunosuppressive therapy pre- and post-transplant, screening potential donors in paired kidney exchange programs, supporting organ allocation decisions in national and regional transplant networks. Number 5. Why do need of this test? The B-cell crossmatch test is essential to 1. Identify incompatibility. Detects harmful donor-specific HLA antibodies that can cause immediate graft loss. 2. Prevent hyperacute rejection when preformed antibodies bind to donor endothelial cells, leading to rapid vascular thrombosis and graft necrosis. 3. Improve graft survival. Selecting immunologically compatible donors enhances long-term transplant outcomes. 4. Personalized treatment. Helps clinicians plan pre-transplant desensitization therapies, e.g. plasmapheresis, IVIG, rituximab, if antibodies are detected. 5. Minimize immunologic complications, reduces need for aggressive immunosuppression post-transplant. Number 6. What happens during the test? The B-cell crossmatch procedure can be performed using different methods, most commonly complement-dependent cytotoxicity, CDC, or flow cytometry crossmatch, FCXM. Step-by-step process. 1. Sample collection. Blood is collected from both donor and recipient. Serum is separated from the recipient's blood for antibody testing. 2. Isolation of donor lymphocytes. Donor lymphocytes, T and B cells, are isolated using density gradient centrifugation. B cells are separated for the B-cell specific test. 3. Incubation. Recipient serum is mixed with donor B lymphocytes in controlled laboratory conditions. 4. Detection of antibody binding. CDC method, complement proteins are added. If the recipient's serum contains anti-HLA antibodies, complement-mediated cell lysis occurs. The degree of cell death, cytotoxicity, indicates positivity. Flow cytometry method, fluorescently labeled anti-human IgG antibodies bind to any recipient antibody attached to donor cells. The fluorescence intensity is measured to assess positivity. 5. Result interpretation. Level of fluorescence or cytotoxicity indicates whether the crossmatch is negative, weakly positive, or strongly positive. 7. How long for my results? CDC crossmatch, 24 to 48 hours. Flow cytometry crossmatch, 6 to 24 hours, can be expedited in urgent transplant settings. Virtual crossmatch, computer-based using antibody and HLA data, few minutes to hours. 8. Prepare for this test. No fasting or dietary restriction is needed. Inform your physician about recent blood transfusions, may affect antibody levels, history of pregnancy or previous transplantation, use of IV immunoglobulin, IVIG, rituximab, or plasmapheresis can alter antibody detection. Sample handling. Proper serum storage and timely testing are essential for accuracy. 9. Risk to minimal risk related to venipuncture, pain or discomfort at the site of blood collection, mild bruising or swelling, rarely infection or dizziness, no immunological risk to the donor or recipient from the test itself. 10. Normal values, test result, interpretation. Negative crossmatch, no binding of recipient antibodies to donor B cells, compatible, safe for transplantation. Positive crossmatch, presence of antibodies binding to donor B cells, incompatible, high risk of antibody-mediated rejection. Normal value equals negative crossmatch, no cytotoxic reaction, or no fluorescence above cutoff. 11. Interpretation of results. Result, meaning, clinical implication, negative, no donor-specific antibody detected, safe to proceed with transplantation. Weakly positive, low-level antibody reactivity may require desensitization, decision based on risk-benefit analysis. Strongly positive, high-titer donor-specific antibodies present. High risk of hyperacute rejection, transplantation contraindicated. Additional points. A positive B-cell but negative T-cell crossmatch suggests antibodies primarily against Class II antigens. A positive T and B-cell crossmatch indicates antibodies against both Class I and Class II, implying greater risk. HAP. 12. Factors affecting results. 1. Recent sensitization events, transfusion, pregnancy, transplant. 2. Passive antibody transfer from immunoglobulin therapy. 3. Technical errors, improper cell isolation, delayed testing, or reagent issues. 4. Autoantibodies or non-HLA antibodies causing false positives. 5. Immunosuppressive therapy may reduce antibody detection, leading to false negatives. 6. Cold reactive antibodies can occasionally interfere with interpretation. Clinical significance. The B-cell crossmatch provides critical information on the immunologic risk of transplantation. Positive results are associated with increased risk of antibody-mediated rejection, AMR, reduced graft survival and early graft dysfunction, need for desensitization or alternative donor selection. Negative results correlate with successful graft function, lower incidence of rejection episodes, better long-term survival rates. This test is therefore integral to personalized transplant immunology and patient management. NAPO 14. No more. B cells express both HLA Class I and II antigens, but Class II reactivity is primarily assessed. Flow cytometry crossmatch is more sensitive and can detect even low-level donor-specific antibodies missed by CDC. Virtual cross-matching combines HLA typing and antibody screening results to predict compatibility without physical mixing of samples, useful in cadaveric transplants. Newer methods, such as Luminex single antigen bead assays, provide detailed antibody specificity profiles. 15. Conclusion. The HLA B-cell crossmatch test is an indispensable tool in the pre-transplant immunological evaluation. It identifies harmful antibodies that could cause donor organ rejection and aids in selecting the most compatible donor. A negative crossmatch indicates immunologic safety, while a positive crossmatch demands caution, additional testing, or therapeutic intervention before transplantation. Thank you. Have a nice day.